You may think cardiovascular disease is something that just happens to old dudes, but the steps to preventing heart disease begin by cultivating a healthy lifestyle today. In this video, we'll show you real things you can do today to help prevent heart disease, whether you're 18 or 65. The content of this series is helpful to everyone, but particularly important to someone with high blood pressure, high cholesterol, low HDL levels, obesity, or a family history of cardiovascular disease. We each have unique risk factors, some of which we can change and some of which we cannot. Part of developing a healthy lifestyle is determining which risk factors you have and making the lifestyle changes to improve your health as much as possible. In this video, we'll review all the risk factors of cardiovascular disease to help you determine which ones to focus on. In the other videos, we'll show you the specific changes you can make to help reduce your risk of cardiovascular disease. Just as nobody has the same fingerprint as you or styles their hair quite like you do, we are each unique when it comes to how best to care for our bodies, especially our hearts. The major risk factors that cannot be changed are your age, gender, and heredity. As you get older, your risk of cardiovascular disease increases. Also, men have a greater risk of heart attack than women do, but as women age, they also have an increased risk. Your genetics are something else that cannot be changed. Having a first-degree relative, like a parent or a sibling with heart disease, greatly increases your risk as well. Additionally, certain ethnic groups are at a greater risk for cardiovascular disease than others. African Americans are more likely to have high blood pressure than Caucasians, which can increase their chances for heart disease. Heart disease risk is also higher among Mexican Americans, American Indians, Native Hawaiians, and Asian Americans. This may be partly due to increased levels of obesity and diabetes among these groups. The good news is there are several risk factors we can change. These risk factors include tobacco use, stress, physical inactivity, poor sleep habits, excess alcohol use, and an unhealthy diet. The next two videos will explore each of these in more depth. The most important thing to remember is that the small changes you make today have a huge impact, not only on the future, but how you feel right now.